we are so excited that you booked your first PRP hair appointment with us. So a couple of things to consider before you come in for your first appointment. I do want you to wash your hair either the night before or the day of your appointment, just so everything's nice and clean, so there's no risk of infection prior to the procedure. I do want you to eat a good breakfast and drink lots of fluids. We are going to be drawing your blood, so I don't want you to get lightheaded, and I want to be able to draw enough blood for the procedure. So we do draw a 30 ml tube. After we draw your blood, we're going to put it in the centrifuge, which is going to spin it really fast and separate the plasma from the red blood cells. The plasma is what we're going to inject into your hair. That is what's great in growth factors, collagen stimulation, and that's what's going to help your hair to grow. It's going to be about 50 to 70 injections into your scalp. We really don't use numbing because we can't put numbing cream on your hair. It's really not effective, and it's not able to get to the scalp where we really need it to. The injections are going to be fairly quick. It does sound like a lot, but honestly, it'll be over before you know it. We are putting fluid into an already area of thin skin, so it is common to leave with a headache and to just feel some pressure there. Tylenol is the best option if you're having a headache or you're having pain. After we're finished with the procedure, we're likely going to give your head a nice massage, give your scalp a massage just to work that product into where it's supposed to be going, to work it into your blood vessels, and just get the best results. When you go home, I want you to avoid any kind of hair dye for 24 hours. After 24 hours, totally fine. You can do anything to your hair at that point. And then I'm going to have you either wash your hair either that night or right away when you get home. Again, just to work the product in, to dilate your vessels and just work everything where it's supposed to go. Another thing I tell people, if you can avoid any hats or tight headbands afterwards, again, we don't want more pressure on that area. Hats sometimes have sweat and bacteria in them, and we're going to be kind of compressing that on the head for a while afterwards. I'd rather you just wash your hair and make sure it's nice and clean, so again, there's no risk of infection putting anything on your head. A loose ponytail or something would be fine. We are super excited to meet you for your appointment and look forward to seeing you soon.